You open your medical app, check your annual blood test results, and there it is. Your PSA level has gone up. Again. Last year it was 2.5. This year it's 3.2. Your mind immediately races to the worst-case scenario, prostate cancer. Take a deep breath. If your PSA is rising every year, it is completely normal to be worried. Millions of men face this exact fear. But here is a secret most doctors want you to know. A rising PSA does not automatically mean you have cancer. To understand why it goes up, we first need to understand what PSA actually is. It stands for Prostate-Specific Antigen. Let's meet the source. This is your prostate gland. It's about the size and shape of a walnut, sitting just below your bladder. It wraps right around the urethra, the tube that carries urine out of your body. And its main job is related to reproduction. Your prostate produces a special protein, the PSA. Think of these proteins as tiny helpers that keep semen in liquid form. Normally, these PSA proteins stay inside the prostate. But inevitably, a small number of them accidentally leak out into your bloodstream. When you get your annual blood test, the lab is simply counting how many of these little blue PSA proteins are floating in your blood. A low number means the prostate wall is tight and secure. But if the number keeps rising every year, it means something is irritating or disrupting the prostate, causing more PSA proteins to spill out into the blood. And naturally, the first thing everyone associates with a disrupted prostate is cancer. It is the most feared word in medicine. But according to the American Urological Association, prostate cancer is actually just one of many reasons for a rising PSA. In fact, there are 3 other very common, non-cancerous culprits that are likely causing your numbers to go up. Let's open the first door. Behind door number 1 is suspect number 1, BPH. That stands for benign prostatic hyperplasia. Let's focus on the word benign. It literally means not cancer. That alone is a huge sigh of relief. But what is it? Well, as men get older, the prostate naturally grows. It goes from the size of a walnut to the size of a lemon. According to the NIH, by age 60, over half of all men have BPH. By age 85, it's up to 90%. So why does this raise your PSA? Think of the prostate like a factory that produces PSA proteins. A bigger factory has more space and more workers, which naturally produces more PSA. And more of it spills into the blood. Because the prostate wraps around your urethra, as it grows, it squeezes that tube just like pinching a garden hose. This leads to the classic BPH symptoms. You might find yourself waking up 3 times a night to use the bathroom. Or you might experience a frustratingly weak stream, or feel like your bladder is never completely empty. The key diagnostic here is velocity. BPH usually causes a slow, gentle, steady increase in your PSA over many years. A PSA going from 2.0 to 2.5 over 5 years might just be your prostate getting a little bulkier with age. And here is a crucial medical fact. BPH does not turn into prostate cancer. They are completely separate conditions. You can have BPH and it might be annoying, but it is not a death sentence. It is just a part of aging. However, what if your PSA jumped up suddenly in just a few months? BPH usually isn't that fast. That brings us to our next culprit. Let's open door number 2, where things get a little heated. Welcome to door number 2, prostatitis. In medical terms, anytime you see a word ending in itis, it simply means inflammation. Just like tonsillitis is an inflamed throat or arthritis is an inflamed joint, your prostate can also become inflamed. This is often caused by a bacterial infection. When bacteria invade, your prostate becomes red, hot, and angry. It's essentially fighting a microscopic war inside your pelvis. Your body sends an army of white blood cells to fight the infection. All this intense collateral damage temporarily breaks down the prostate walls. Because the walls are compromised during the fight, a massive flood of PSA proteins escapes into your bloodstream all at once. Unlike the slow, gentle rise of BPH, an infection causes your PSA to spike dramatically. It might jump from a 2 to an 8 in just a month. You will usually know if this is happening. Symptoms include a burning sensation when you pee, deep pelvic pain, or even a fever and chills. The good news? A simple course of antibiotics usually clears the infection, and your PSA levels will eventually drop right back down to normal. But what if your PSA spiked suddenly and you feel perfectly fine? No pain, no fever? Let's open the third and final door. Door number 3 is everyday mechanical stress. You see, the prostate is a very sensitive, squishy little gland. Something as healthy and innocent as taking a long bicycle ride on a bumpy road can actually irritate it. The narrow seat of a bicycle physically massages and bumps against the prostate, literally squeezing it like a sponge. Other everyday activities, like sexual intercourse and ejaculation, or even a physical prostate exam by your doctor, temporarily squeeze extra PSA proteins out into your blood. That is exactly why doctors strongly advise avoiding bicycling and ejaculation for at least 48 hours before your PSA blood test. You don't want a false alarm. So, if it's just aging, an infection, or a bumpy bike ride, when should you actually start worrying about cancer? Let's look at the real red flags. Prostate cancer happens when normal cells inside the prostate mutate and start growing out of control, turning into rogue cells. These aggressive cancer cells destroy the normal architecture of the prostate wall. This destruction creates massive leaks, allowing PSA proteins to escape. But remember, BPH and infections also cause leaks. So doctors look for a specific red flag called PSA velocity. Velocity measures how fast your numbers rise. Generally, an increase of more than 0.75 within a single year is highly suspicious. If BPH is a slow, old turtle walking up a hill, aggressive prostate cancer is a sports car accelerating on a highway. The second red flag is called PSA density. To figure this out, doctors compare your PSA score to the physical size of your prostate. Remember the factory? If you have a massive prostate gland producing a PSA of 4.0, that is low density. It's totally normal for a big factory. But if your prostate is tiny, the size of a walnut, yet it's pumping out a PSA of 4.0, that is high density. That small factory is hiding something. Finally, the third red flag, the free PSA ratio. In your blood, PSA proteins travel in two ways, free or bound. Cancer cells tend to produce PSA that acts like a prisoner. It gets bound or handcuffed to other proteins in your blood. On the other hand, benign conditions like BPH usually release free PSA, proteins that float around independently, without handcuffs. So, if your doctor runs a free PSA test and finds that your free PSA is very low, under 10%, the risk of cancer is higher. If all this math is making your head spin, don't panic. You don't have to calculate any of this yourself. That is your urologist's job. And if the numbers do look highly suspicious, they will move on to the next phase of the playbook. The very first tool in the playbook is one that every man dreads, but it takes less than 10 seconds. The digital rectal exam, or DRE. Doctors aren't doing this to torture you. The prostate sits right next to the rectum wall. By feeling it, they can check its surface. A healthy prostate or one with BPH feels soft and smooth, like the tip of your nose. Prostate cancer often feels like a hard, rocky nodule. If the doctor feels a lump, or if your PSA math is highly suspicious, the next game changer is an MRI scan of your prostate. In the past, doctors had to guess where the cancer was. Today, a multi-parametric MRI uses powerful magnets to take incredibly detailed 3D pictures. Radiologists look at these images for any dark, suspicious shadows. They then grade what they see using a system called the PI-RADS score. The PI-RADS scale goes from 1 to 5. It tells your doctor how likely it is that the shadow is actually an aggressive cancer. A score of 1 or 2 means it is highly unlikely to be cancer. Your doctor might just say, let's keep an eye on it and test again next year. But a PI-RADS score of 4 or 5 means there is a high probability of clinically significant cancer. This shadow needs to be investigated immediately. And that brings us to the final diagnostic step, the prostate biopsy. The only way to know 100% if a shadow is cancer is to look at the actual cells. Thanks to the MRI, we don't have to do blind biopsies anymore. Doctors confuse the MRI images with real-time ultrasound, acting like a highly precise GPS system. This targeted biopsy allows the doctor to navigate the needle exactly to the PI-RADS 5 shadow, ensuring they hit the exact spot in question. They take a few tiny cores of tissue, about the size of a thin piece of thread. The whole procedure is done under local anesthesia and is usually very quick. Those tiny threads of tissue are then sent to a pathology lab. There, a specialist will look at the cells under a powerful microscope. The waiting is often the hardest part. When the results come back, if cancer is found, it will be graded by something called the Gleason score. The Gleason score doesn't grade how much cancer you have, but how aggressive it looks. Strangely, the scale for prostate cancer usually starts at 6. A Gleason score of 6 means the cells still look mostly normal. They are very lazy, extremely slow-growing, and rarely spread. But a score of 8, 9, or 10 means the cells look wildly mutated. These are the aggressive ones that want to spread quickly. If your biopsy comes back as a Gleason 6, your first instinct might be to panic and yell, "Get it out of me." But hold on. For low-grade, slow-growing cancers, doctors often recommend a radically different approach called active surveillance. Why not just remove it? Because the prostate is surrounded by delicate nerve bundles that control erections and bladder function. Surgery or radiation can sometimes permanently damage these nerves, leading to incontinence or erectile dysfunction. If your cancer is a Gleason 6, it's like having a slow, sleepy turtle resting in your backyard. You wouldn't use a bazooka to get rid of a turtle, right? The bazooka would destroy your whole yard in the process. Now, if you had an aggressive Gleason 9, that's a tiger. You absolutely need to take immediate, strong action against a tiger. But with the turtle, active surveillance means you just keep a very close eye on it. No bazookas required. You simply continue to get regular PSA blood tests every few months, and maybe an MRI once a year to make sure the turtle isn't growing. If the tests eventually show that the cancer is starting to wake up or become aggressive, then your doctor will recommend treatment. Treatment options like robotic surgery or targeted radiation are highly advanced today, and they are incredibly effective at curing the disease. In fact, if prostate cancer is caught early before it spreads, the 5-year survival rate is nearly 100%. While doctors monitor your numbers, what can you do right now? You actually have a lot of power to support your prostate health through daily habits. Let's start in the kitchen. Your prostate's best friend is a powerful antioxidant called lycopene, which is found abundantly in red tomatoes. But here is a pro tip. Cooking tomatoes in a little olive oil actually breaks down the cell walls, making the lycopene much easier for your body to absorb. Next up are cruciferous vegetables like broccoli, cauliflower, and cabbage. They contain a special compound that helps your body clear out harmful toxins. Swapping out just one of your daily coffees for green tea provides your prostate with catechins, powerful plant chemicals known to reduce inflammation. On the flip side, you should severely limit charred red meats and highly processed foods. These increase inflammation throughout your entire body, including the pelvic floor. Beyond the kitchen, regular cardiovascular exercise is crucial. Men who exercise frequently have a significantly lower risk of developing severe BPH symptoms. Staying active helps reduce visceral belly fat. Excess belly fat releases inflammatory chemicals that directly irritate your squishy little prostate gland. If you are already dealing with BPH symptoms, pelvic floor exercises, also known as Kegels, can help strengthen the hammock of muscles around your bladder. Hydration is important, but if you're waking up multiple times at night to pee, try stopping all fluids about 2 hours before you go to bed. It also helps to limit caffeine and alcohol in the evening, as both of these are chemical diuretics that actively irritate the bladder lining. And according to a major Harvard study, frequent ejaculation helps clear out old fluids and may actually lower your risk of prostate issues over time. Finally, don't ignore chronic stress. High cortisol levels keep your body in a constant state of inflammation, which makes all prostate symptoms significantly worse. Prioritize deep, restorative sleep. It is during these quiet hours that your body's immune system goes to work, repairing cells and clearing out biological trash. By combining these smart daily lifestyle choices with regular medical checkups, you are taking proactive, powerful control of your long-term prostate health. So, let's bring it all together. The next time you open your medical app and see a rising PSA number, take a deep breath. Remind yourself that PSA is just a protein, and there are 3 incredibly common, non-cancerous reasons it might be leaking into your blood. If it is cancer, your doctor has a powerful playbook to figure it out using PSA velocity, density, and the free ratio. And with modern technology like multi-parametric MRIs and targeted biopsies, the diagnostic process is incredibly precise and much less scary. Even if you do get a cancer diagnosis, remember the turtle and the tiger. Many low-grade cancers simply need to be watched, not aggressively attacked. For those that do need treatment, the tools we have today are so advanced that the survival rate for localized prostate cancer is near 100%. You are not powerless in this journey. By embracing a prostate-friendly diet, staying active, and reducing stress, you are building a biological fortress. Your PSA number is not the whole story of your health. It is simply one piece of a much larger puzzle. Disclaimer time. This video is for educational purposes only and cannot replace a real medical diagnosis. Always consult your urologist or primary care doctor. If this video helped ease your mind about your PSA score, please hit the like button and subscribe for more Doodle Health Science. Stay proactive and stay healthy.